Welcome back. Now, the Young Nurses Indaba trade union is fighting against what it terms austerity measures in the health sector. The union marched to the Department of Health and the National Treasury in the city of Tshwane to hand over a memorandum of demands. We are joined by Shingange, the president of Nehawu, to give us input on this matter. Thank you very much, Mr. Shingange, for your time here on all angles. Now, of course, this is something that I think the nurses have a point on, right, in terms of the fact that they're saying those who were given contracts during the time that COVID was rife, getting rid of them now when we don't know if the cases will rise again doesn't make sense.
Yes, good afternoon. In fact, we want to pledge our solidarity with the young nurses in Indaba in terms of their struggles. You are correct, not only because they were given contracts during the COVID. Actually, before COVID, the healthcare system in this country was already collapsing. It was not at a point where it's supposed to be ready should we get a pandemic. It was not at a point where it was responsive to the burden of disease that we are having. The shortage of staff in the public health care was always a pandemic. It's on itself. So when you were faced with the pandemic that we are having, with you are not employing more nurses, more porters and more cleaners, you run a risk of not being able to fight any pandemic in future. So the call of the fact that there were people who were contracted during COVID because it was clear that the healthcare system is not capacitated enough to fight these diseases. And you want to get rid of them as if you were fully capacitated before COVID. It's actually absurd. And our view is that more healthcare workers are needed, more infrastructure is needed, and more resources needed in the public health system.
And of course, like you said, this is a public health system that was already strained in terms of the number of nurses compared to the number of people they need to serve before COVID. And it became worse, and COVID made it quite evident when a lot of people were going to hospital.
No, that's true. That's true. So we're saying we are now facing the advent of a fifth wave now. And then it is clear that we are going to be faced with many more disasters going forward. But like I'm saying, the vacancy rate in the public health is so alarming. So if anything, especially if we are talking about ever having a national health insurance in this country, which on itself not only needs an infrastructure, it also needs a huge in terms of the human resources. You can't be getting rid of people now. You need to be employing more. You need to be taking into permanent positions those community healthcare workers that are roaming the street every now and then, trying to make sure that our people get medication, that our people are bathed, our people are fed. That kind of a task, it's a permanent kind of task that you need there. And you can't just be getting rid of those people. So that's what actually we are saying. We support this call by this union that went to the strike today, and we think the next time they're on the street, surely they're going to be with the rest of us on that street, because it needs more and more of workers to stand in one voice, in unity, in order to make sure that you can't have treasury that in the developmental state that they are supposed to be building. Every time they present a budget, that cuts on expenditure on the healthcare system. When the majority of South Africans can't afford the universal healthcare services because they do not have medical aids. Many of them are elderly, many of them are sick, they are not working, but they are being deprived of a basic need of healthcare services. And you also stress the public workers there, because these public healthcare workers themselves, to seeing themselves helpless, not being able to help their community members, it's stressful to them. Themselves, they've lost their life. Themselves, they've lost their colleagues around the COVID-19. They were not properly trained. They were not properly protected. They are underpaid, as you know now. In fact, those who are in the public service, they did not even get the salary increase since 2020. So they've suffered an inflationary reduction of the inflation. So it can't be correct that we want to service our people with such a demoralized public service.
Well, thank you very much, Mr. Shingange, for your time. That's all the time I have for you today. Well, I wonder what National Treasury is going to say. They already couldn't give healthcare workers an increase, and to ask for them to give more staff permanent employment is something else. That was Shingange, the president of Nehawu.